Good morning. Welcome and thank you for joining us for our Northern Light Health Good Health is Good Business Zoom conference. I hope all of you have had very happy holidays with your friends and family. We wish you a healthy, successful new year. It's back to business. We will start off today with an update on COVID-19 and other health issues in the headlines, followed by a deliberate approach to connecting, supporting, and helping employees, customers, friends, and family. This is the early stage of a movement. I'm happy to inform you, you are getting in on the ground floor. I'm Dr. Ed Gilkey, Senior Physician Executive at Northern Light Beacon Health. I'll be your moderator for the next hour. Our panelists today are Suzanne Spruce, Senior Vice President and Chief Communications Officer of Northern Light Health. Dr. Anthony Eng, Medical Director of Community Services and Behavioral Health Professional Services at Northern Light Acadia. Greg LaFrancois, Senior Vice President of Northern Light Health and President of Northern Light A.R. Gould Hospital. Dr. Jim Jarvis, Director of Clinical Education at Northern Light Eastern Maine Medical Center and Senior Physician Executive of COVID-19 Incident Command at Northern Light Health. Before we get started, I will read our legal disclosure. The coronavirus pandemic is an ongoing, continuously evolving situation. Northern Light Health encourages everyone to follow federal and state governmental guidance and mandates. Northern Light Health does not know the particulars of your situation, so the information presented today is general in nature and is based upon Northern Light Health's own experience, which may or may not apply in your specific situation and which may be revised as we learn more about the coronavirus. Accordingly, following any guidance Northern Light Health presents today in no way guarantees that you, your employees, and/or your customers and clients will not contract or spread the coronavirus. A reminder, this hour is for you. If at any time you have a question for our panelists, please use the Q&A function. I'll keep track of your questions and have our speakers respond. Also, I hope each of you will take a few minutes immediately following this hour to answer our quick 5-question survey. Your input directly affects our topics and helps guide our future conferences. Dr. Jarvis will start us off with the latest on COVID-19 and other current health issues. Dr. Jarvis?
Thank you, Ed. So we'll just talk about what's really out there in the news right now, which is XBB 1.5. And so what is that? It is yet another variant of COVID or the coronavirus that causes COVID-19. And it's really just a mutation that we've seen before. It's actually two mutations that joined together and became a new variant for us. Should we be concerned about it? Absolutely. Mostly because it is now considered one of, if not the most contagious variant that we've seen to date. But there's no need to panic. And the reason being is that this is still in the Omicron family. And we've been dealing with the Omicron family of coronaviruses now for a little over a year as being the dominant strains. And so as we see a new one, the reason why we're concerned is because it's more infectious. However, it doesn't seem to be causing more severe disease. That's good news for us. And because it's in the Omicron family, it appears that we have great protection. Those of us who have received the most recent bivalent COVID vaccine booster, because that one gives us protection against the original strain that was causing COVID and to the Omicron family, of which this is just another variant there. We're concerned because it's so infectious that even people who have been vaccinated before or who had previously been infected with COVID may still be susceptible to getting the virus again. And that's where our concern is, because if we start seeing large numbers of individuals who are getting sick, then we may start to see an increase in hospitalizations and deaths again. So how do we protect ourselves? First and foremost, make sure that you are up to date with your booster series, particularly getting one of those bivalent vaccines, because it gives added protection against the Omicron family. And then doing all those good things that we've been talking about now for 3 years, which is good hand hygiene, washing our hands and using hand sanitizers on a regular basis, staying home when we're not feeling well. So supporting your employees and your customers to stay away when they're sick, particularly with respiratory viruses. And then just practicing good public health, good social distancing. And then for those individuals in particular who are at high risk of severe disease, that would be people over the age of 50, certainly those over the age of 65. And anyone with an underlying health condition should really mask while they're in an indoor space until we get through this next little blip during this pandemic. And so with that, Ed, I think I'll turn it back to you.
Well, thanks, Jim. Before I let you go, couple of quick questions. When we think about data, it's a funny art form. It can tell stories in many ways. And over recent weeks, we've been hearing reports that more vaccinated people are being hospitalized compared to unvaccinated. And you helped us understand a little bit about that, that there's many more people who had at least one vaccination compared to none. So, depending on what message you want to put out there in the media, that's how you interpret this data. So therefore, okay, if you could comment on that, that'd be great.
Sure. So, and I think it's a twofold thing that we have to understand. First is semantics, the words, the language that we use. When we talk about vaccinated, that means that at any time you received at least one dose of a COVID vaccine, which means that you could have received a COVID vaccine way back in early 2021 and only received one dose, and we count you in that vaccinated category. And it's a good chance that those people have almost no immunity to the current viruses that are the variants that are circulating right now. And so but they still get counted in that. And the other thing is really about math, right? There are far more people in the United States who are vaccinated than those who are unvaccinated, particularly if we talk about if you just had one shot and that's all you've had. And so there's just far more people there that can get infected from a population standpoint. When we look at a percentage standpoint, though, it is still clear that those who are unvaccinated have a much higher risk of having severe disease and dying from COVID-19. Those people who have had the most recent COVID booster have a much less chance of hospitalization, severe disease, and dying from COVID-19.
Yeah, I think that point is really lost at times in the media reporting of this data. So thank you for that clarification. I'm going to take it a little bit step further here. We're also hearing that people are getting cardiac inflammation side effects from the vaccines while not addressing the widespread infections by COVID as a possible cause. So it's like, okay, well, people are getting vaccinated, getting boosted, and then somewhere in the future, they're getting the cardiac inflammation syndromes that we're hearing about, and it goes immediately to the conclusion that it was vaccine rather than they could still get COVID-19, and that can play a role. So what's your thoughts there?
Yeah, absolutely. So one thing to remember, that any kind of cardiac inflammation, so myocarditis or pericarditis, related to the vaccines is still extremely rare. And almost all the cases have been in males somewhere between the ages of 15 and 30. All of those cases, those people responded well to routine treatment. Very few, if any, had to be hospitalized, and I'm not aware of any that died from that. So that's good thing for the vaccine. Contrast that to getting infected with COVID-19. Many more people have had complications, cardiac complications, including this inflammation that we've talked about. And that's a much more severe thing. We've also know that people who have had COVID-19 have a higher likelihood of having more severe cardiac conditions like a heart attack, resulting in hospitalizations and death. So the vaccines overwhelmingly are incredibly safe. COVID-19 is not safe. And so that's the reason why we continue to talk about that. If you want to put it in other terms of things that we do on a routine basis, wearing a seatbelt. Sometimes putting a seatbelt on can cause some injury to you. But the protection you get if you were in a car accident, the seatbelt is far better to be doing that than any minor injury that a seatbelt itself can cause.
Great, thank you. That's really reinforcing. I have one more question. Looking at XBB.1.5, it certainly looks like it's going to become the predominant subvariant that we're going to be dealing with. Like you said, it's highly infectious. It's going to really, the numbers are going to go up significantly. In terms of understanding some planning, actually, this comes from a meeting I was at a little bit this morning where people are trying to anticipate what's the surge going to look like in February and March. So I'll ask you right here on the spot, what's it going to look like? And once again, I know it's a crystal ball
So I
question.
have my crystal ball here, Ed, and it's very
Yeah,
cloudy.
I
And
hear
the
you.
further down we, it's one of those things. People think that as the further down we go, the more we should know. The further down we go, actually, the less we know when it comes to predictions, because there are far more variables than we've ever had before. When we had a single strain that was dominant, it was more easy to predict what was going to happen. The problem is that these variants are coming fast and furious, and we just don't know what's coming down the pike. The good news is that really we have seen a strong, significant decrease in severe disease and death because people have been vaccinated and continue to take precautions in some way or another. And then more importantly, we have treatments that are very effective against severe disease, particularly Paxlovid. So anybody in a high-risk condition, or if you're over the age of 50 who does test positive for COVID-19, reach out to your provider, because you may be eligible to get Paxlovid, which is a great treatment to keep you from getting sicker than just a common cold-like symptoms.
So from a healthcare system planning perspective, it sounds like we're well prepared for pretty much whatever comes our way at this point to try to manage it, but we're not anticipating a huge amount of, like, say, surge in hospitalization and severe illness at this point. Is that correct?
Right now, I would not say that we're going to see the surge where we start seeing hospitals having 70, 100 or more patients with COVID. I think, the day-to-day numbers, we're always going to see our large medical centers here in Maine have somewhere, some baseline number, depending on size, between 10 and 40 patients at any given time. I think that's just our new norm, and I don't see that going away anytime soon.
Excellent. Well, thanks for all that clarification, Jim. I'll let you go until a little bit later in our session here. Over the past 2.5 years, we've come to recognize the impact the pandemic has had on all aspects of people's lives. You've seen these impacts in your lives, your employees' lives, in everyone's lives. No one has been untouched, all in common and even unique ways. We have all had to learn a lot about people. Mental health has been a frequent and diverse topic of this series. We've talked about the science findings, how to recognize problems, what tools are available to work our way through those problems, and community resources to help support people. It really has been a very comprehensive journey. Today, we are continuing that journey by getting back to basics, building a foundation, and launching us into the new year. The title of today's session probably made you smile, or perhaps smirk. Hey, Maine, how are you? We all use "how are you" as a rhetorical question. It sort of has meaning depending on the circumstances. Frequently, though, it is used as a platitude, not really seeking an answer. During today's session, we are going to look at it differently. We're going to give it real meaning, a real question, looking for genuine answer. How are you, really? Real meaning with the understanding of how to respond when the answers are difficult. To start us off, Suzanne Spruce will lay the groundwork for the "how are you" strategy by sharing the vision behind it. Suzanne.
Thanks, Dr. Gelke. And how are you?
Well, I am fine. Thank you for asking.
I am so pleased to hear that. And thank you so much for inviting me here today. This is one of my favorite things to talk about.
Yeah, thank you.
How are you is a question that many of us often ask, but how often do we actually stop and listen for a reply? I personally didn't realize how often I said, "Hi, how are you?" and kept on moving until we started this movement. And then I had to remind myself to slow down. If I'm going to ask the question, wait for a reply, and then engage with the person that I'm addressing. So how are you is a way to connect. It's a way to reach out. And it's also a way to get people talking and hopefully getting people to re-engage with their health and their health care, which we know many Mainers have been reticent to do since the pandemic. So how did this movement come to be? Well, we did our homework. We knew the pandemic had turned life upside down. We were hearing anecdotally from friends, family, patients that it still had a grip on much of society. So we fanned out across the state. We visited every corner of Maine, asking a lot of questions. We talked to real Mainers in coffee shops, on the street, at the store, on the phone, wherever we could find folks who were willing to engage in conversation with us about what is life in Maine like for them right now. And what we learned is the pandemic does have a lot of folks concerned about returning to living their best life, even to seeing their doctor for preventive care. And loneliness is real for a lot of Maine people. A lot of people are still feeling very alone. So before I ask Lainey to go to the next slide, I want to call out these cute kids on this slide here. They are from Mrs. Wright's 4th grade class at Mapleton Elementary School, and they had a lot of fun during this photo session. All of the photos that you will see in our How Are You movement are of real Maine people. So on the next slide, we'll talk about how this came to life. So to back up a little bit, Northern Light Health met the COVID challenge head on. We had a can-do culture of yes, and we did so because it was the right thing to do. We showed up, we said, yes, we will help make COVID testing easy. We will help make getting a vaccine easy. We will do whatever we can to help. And we will give you information that you can trust. In fact, this webinar series was born out of the need to keep our community informed, give them news they can use, and a source they can trust. So we were able to position Northern Light Health as the health system that Mainers could depend on, that helped people understand not only who we are and what we stand for, but how we can help them. And everyone across Northern Light Health stepped up and showed up. And as a result, the Northern Light Health brand did get what we call a halo from that remarkable commitment that started at the very top of our organization with our CEO saying, we have a culture of yes. So every spring, we reach out to Mainers statewide, and we ask a lot of questions to provide insight on whether consumers in Maine are recognizing this system, how much they can trust us. Can they identify opportunities for Northern Light Health to improve and to grow? And then we track that performance on those same questions year over year. And that's how we got to the How Are You movement. We're pleased that the 2022 brand tracking showed 90% statewide recognition of our system. And that's quite remarkable, given that it's only been 4 years we reintroduced ourselves to the people of Maine under that name. So now we are putting the brand to work by asking, how are you? Next slide, Lainey. This illustration, I won't spend a lot of time here, but it demonstrates living, thinking, solving moments that we all have. And we all have these, even if we're not conscious of it. When we talk about the consumer, the patient, the customer, we're talking about us, ourselves. We're all consumers of goods and services. So think about how busy you are in your day, how full your life is, and maybe even how full your head is. If you're not working in healthcare or actively seeking care, have a need, you're probably not spending a lot of time thinking about healthcare or healthcare providers. So I equate it to looking for a refrigerator. We all need one, but we're probably not actively looking for one until we actually do need a new one. And then it can be a little overwhelming with the depth of models and information. And healthcare is a lot like that. There's a lot of information, there's a lot to it. And so we need to get the consumer's attention so that we can be as close to top of mind as possible. When they're looking for care, we want them to look to us. So we launched the How Are You movement in the fall with a full display page in the major dailies and in some weeklies around the state. And we backed it up with some great video and photos of Maine people who agreed to participate with us. And then we also conducted outreach online, TV, social media, et cetera. Hopefully some of you have seen some of this information out there. But we tag all of our outreach, whether it's in advertising, whether it's public service, posters, or what have you, with Northern Light Health / How Are You? So on the next slide, you will see that that web address brings people to our How Are You content hub. It's a landing page that's full of useful information. And the best part of this is people are coming to it. A lot of folks have already used this page. We are updating it actively. And I don't just say that we're pleased because we're happy to have people coming to this landing page. We're excited because people are engaging once they're here. They're scheduling their own mammograms, they're finding providers, they're researching the care that we offer, they're taking quizzes for their own behavioral health, mental health, and other needs. They're sending us email for two-way engagement, and they're asking us questions that we can respond to. And people are also telling us what they want to see more of on this site. So like I said, we'll be actively and updating it so that people will want to keep coming back and not see the same thing over and over. So we also know it's working because people on average are spending 2 minutes and 35 seconds of active engagement with content on this site. So that is pretty long time online on one page, 2 minutes and 35 seconds. Typically, unless you're online shopping for groceries or something, people tend to stay on a web page for less than a minute, so that folks are visiting us, sticking around, playing the games and taking the quizzes and sending us questions. That is really great news because we are providing a service that people are looking for. So lastly, I do want to say this is not a marketing campaign. This is not something that we're doing in this year and then it's gone and we're on to the next thing. So it's not a fad, and it's not just eye-catching advertising. It's about connecting with people and reaching those who need us and how we can make healthcare better for them. Also, this landing page activation just shows you how much engagement that we've had on this site. And again, the average time on the page is about 2 minutes and 35 seconds. And so with that, I wanted to say that while it's connecting about with people and reaching those who need us and how we can make health and care better for them, that is something that Dr. Ng is going to be talking about next.
Hi, thank you, Suzanne. Thank you for passing this over to me. Usually I'm pretty clumsy with switching over, so the question for me is not how are you, but where are you? But anyway, thank you so much, and thank you for setting the tone and stage for the How You Campaign. It's really a reminder why folks need to connect, and just speaking of some of the issues that may happen when folks don't connect. The biggest thing is that people feel alone in our experiences and feelings, that we become thinking this is only us that go through this and no one else does. And strangely enough, by the way, I forgot to mention that this alone feeling is actually not only unique to the pandemic time, because some studies have shown that even prior to pandemic, there was a significant number of people that were impacted by feeling alone. And this could be impacted by age, where they live and so forth. And certainly Maine, with the rural areas we have a lot more of those folks at risk. But people do feel, that their experience is unique. Now, granted, everyone has a unique experience. We appreciate that. But there are also some commonality. And I think when people feeling alone, they don't see that there's other people who may have solutions, people who may have strategies to help them through it. We also become tunnel vision, because when you're alone, you're too distressed to think about much of anything else. So what you focus on, what's in front of you, but rather than the big picture. And that could really, hinder things in terms of work or family. Of course, there's feeling of sadness, anxiety, and anger that comes from it. We also tend to find substitute connections, which are often not the best connections, and they're not really connecting. So social media is a good example. People turn to Facebook, Instagrams, whatever it may be, to see how many likes, how many people follow me, as a way to say I'm connected. But that's not connection. That's virtual something. And people get upset because they don't see how many people liking the page as much. And I think this is just a wrong way to adapt. I talk about adapting. I mean, people also use some maladaptive skills, such as just not even using the drugs and alcohol, which is what people often think about, but even things like exercise. I mean, I've heard this, response from people say, "Oh, I decided not to take a walk because I can't find someone to walk with me." So they really can alter your lifestyle in so many ways. Next, please. So it's important that we connect more, because, as I mentioned before, now we feel that the experience is shared, that we are not the only one going through this. There's a lot of similarity. And when people find similarity between individuals, they feel better. There's less risk of burnout. There's better hope, because people can see that people are improving on it. Also, when we do this connecting, whether it's how are you or whatever it may be, we not only giving, but we're receiving. We're receiving this positive energy. And that makes us feel good. So how many times when you if you connect someone and there's a very good exchange and people said, thank you so much. Not only the person feels good that you said hi to them, but also you feel good because you made a difference. And I think that's a really, good thing. And I like to say that that's a little bit of a intoxicating feeling, because it is really good to feel that and you want to do more of it. So like almost continue the cycle and make it more. There's greater life and work satisfaction. Is also promote greater resilience in terms of dealing with stress that's in your life, whether it's work or family. It's better mental health. And of course, it's better physical well-being, because that's all tied in together with better healthcare and heart rate and all kinds of stuff. Next, please. Now, as much as we talk about really the need to connect with others, it's also important to connect with yourself, because part of the reason I think many people mention that we often say, how are you, and just keep on walking, is because we're in a rush. We're always moving fast and we don't have time to do anything. But when we stop to say, how are you, you're not only checking in on someone, but you're also giving yourself that few seconds of pause, a moment of pause where you can slow things down and just break the cycle. And that alone sometimes can do a lot of wonders. And, if you say 2 or 3 hellos in just one trip down the hallway, that slows you down in terms of just giving you that meditation period, for lack of a better word. But it does, make you, break the cycle of urgency. So I think it's important, like I said, how are you not only to other people, but how are you to yourself? Ed?
Well, thanks, Tony. Greg LaFrancois now joins us. Greg, as president of Northern Light AR Gould, you are responsible to over 1,000 employees, their families, their communities, and all of the patients and their families. So start us off by providing some insight into your concern for staff, and then more broadly, the communities.
Absolutely. Yes, thank you, Dr. Gilkey. So, there's the work that we do is extremely important. It's very detailed work, and we want our staff to be 100% focused on our patients. That can only happen if we as leaders throughout the organization are taking care of our staff, that they don't have other things on their minds. As soon as we know about them, that becomes our issue to take care of, and they can again focus on the work that they're doing. So this is extremely important. Every organization I've ever joined, I've created the culture, because one leader can't do it. I can't walk around and take care of everybody's needs. I need every leader focused similarly. And so I've made that a priority. And it's interesting, it gains momentum as people realize, it's okay for me to be walking down the hallway a little slower and take the time to talk to people. It's okay that I'm late for that meeting because I stopped and I took care of some business. And it's critical that we create that culture. And I'll tell you that for me, as I reflect back on the many bits of information that I've acquired that way, I am grateful. We've made improvements in processes and how we deliver care in our hospital because I took the time to talk to somebody who's seen the process and knows it very well. You've got to find those opportunities, those moments to engage with the staff. I make it a point when I'm moving throughout the facility to stop into a department and just check in, see how folks are doing. And when I talk to them, I'm not working from a script. I literally want to know who you are, how you living, how are things going for you. And it's interesting, when I join a new organization, nobody knows me and I don't know them. And so they're awkward sometimes, and people will shy away from maybe engaging because they feel awkward. But as you do that and you get to learn more about people, you start caring about people and you actually want to stop in and see how they're doing and follow up on a conversation you might have had. And similarly, when I know my staff, when I walk down the hallway and I ask how they're doing, and they may just say, oh, I'm doing fine. I know if they're not doing fine. You know what right looks like. And there have been many times where I've done a U-turn and we've walked just a little ways just to check in and to see. And I'm careful not to, I don't want to pry. If there's something that they don't want to share, that's fine. I totally understand it. But I want them to know that they are my #1 priority. And so when they raise an issue to me, that goes to the top of my to-do list. Everything else will be subordinate to that. We're going to take care of that issue first. And that's important because I've got 1,000 employees. Somebody's got a problem. And if I go and I round on this facility and I don't have any notes in my notebook, Either they're not trusting me or I wasn't listening. And that's a problem. And I tell that to all of my leaders, that if none of their staff have an issue, they don't trust you. And so you've got to work on that. So it was very important. And what I really enjoy is when I do stop and ask how someone's doing and I stop for the answer, they're shocked. And you can see, and it builds that trust, I think, over time, because they know that they can talk to me. I think it's important that extend to our community, because through the pandemic, we were telling so many people what they're going to get and what we're going to do, because we were following very rigid guidelines, national guidelines. But in healthcare, we want to be able to meet their needs, and you can only do it if you know what your community needs and how they want to receive care, how they want to receive communication. And so I make it a point, not just myself, but all of my leaders are engaged in our communities, whether it's in dance programs in the community, hockey programs, basketball, they're on town council, and we all share that information, and it's really powerful because it's allowed us to focus on our community more completely. And so that's been helpful. I seek out, I want to know what I'm doing wrong. It feels good when folks tell me what I'm doing right, but I truly want to know, what was your experience? How long did you wait in the emergency department? Can you give me a recommendation? How can I improve this? And so I seek out groups that'll give me very, very honest feedback. And I think that's important because when we ask how they're doing, literally, they're getting ready to give me a lot of information that's going to make us better and allow us to take care of the community. So that's, from my perspective as a leader in this organization, that's the culture that I've tried to build. And I think it's worked effectively.
Greg, I'd like to get into a fine point of something you just said. You were talking about a notebook. And I'm thinking, one of the things I recall rounding into hospitals in the past was when people tell you stuff, you need to make sure that they understand that you're listening to them. And one of the best ways of making them feel listened to is that you actually do something and address the ideas that they've had, the suggestion they've had, the complaints they've had. So, but when you think about doing that in a kind of a formal way by taking notes, how do you do that balance, that leadership balance between looking mechanical by taking notes and being very genuine, which I know you are? What's that secret there?
That's a great question. So there's my notebook, and it's with me 24/7. And when I bring new employees on, I'm in their orientation. The first thing I tell them is, this is my to-do list, and I need you to put the items on this to-do list. I will always have it with me, because once I write it down, I'm going to follow up on it. We're going to run it to ground, and I'm going to circle back and let you know what the solution is. And I can only do that if it's documented. So I don't think, as a matter of fact, I think people are surprised when they see me take notes. It's interesting. I'll be in like an update where we're briefing, and someone will say something, and I'll grab my book and I'll start taking notes. I'll notice some of the other leaders out there will start grabbing a piece of paper and scribbling it down, because they haven't got that habit yet. But this has been a habit of mine since as long as I've been a leader, is to always have a notebook and to take notes, because I take this very seriously. I have learned incredible. Well, I'll give you an example. I had nurses that were so specialized we could never have them on vacation, or they could be on vacation, but they had to schedule it a year in advance. Oh my goodness, they can't do that. And one time sitting down at lunch, somebody gave me enough trust that they shared that with me, and we figured it out. We found a solution so that they could attend all of those pop-up life events that occur. And I made it a point. It was a little bit technical because I had to coordinate with a lot of departments. It was good to have it written down, and I could keep reflecting on it and why we were going to address that issue. It's very important.
So you probably do some town hall type of work as well. Do you tie in what you pick up on rounds into the town hall to help people know that when you tell me about things, I actually do something about it?
Yep. So I do town halls, but the more effective use of my time is to do a reverse town hall. We put out a lot of information. And when I'm rounding, I just ask about it. Have you heard this?
Wow.
What is your feeling on this? How are we doing in this area? Many times people say, I didn't even know about that, because it ends up in some kind of a communication book or something, and they didn't follow up on it. After town halls, I'll go around, because we tape them, and I'll ask, did you sit in on it? Did you hear anything? So again, it's nice to have something to talk to your staff about. And I find when it's just me one-on-one at a nursing station, I'm actually hearing the feedback of kind of the coordinated feedback of all the nurses on the floor, because the spokesperson is letting me know, we feel this way, and this is how we interpret what's going on. And for me, that's more important, because then we can address any misunderstandings. And also unintended consequences. There are times that we'll put a policy out there, and if you take the time to listen to how it's being implemented on the floor, you can improve it right on the spot.
Yeah, so Greg, when I hear us talking about rounding, it's second nature for us in healthcare, and rounding might be a term that's a little bit different in other businesses and folks that are listening. I equate that to management by walking around. So it sounds like it's about the same thing. And in terms of what you're finding as a success formula, thinking in terms of rounding or management by walking around with your staff, and then separately with the community, help us understand a little bit about what time investment you're talking about here.
Well, it's the majority of my job. It is well over 50% of my job is spent out engaging with those folks that are doing the work, or those folks that are receiving the work. And so I'm constantly engaged, because when I get feedback, I've got a couple hundred leaders that help me do my job, and so I can bring that information back to them, and they can get to fixing the problem. My job then is to get the answer and circle back and make sure that people understand we have made the change that they were looking for, and constantly engaging with them. I'll give you an example, and this is something where I might be a little bit unique. I don't know other managers other leaders that do this, but I always have lunch in the lunchroom with the staff. And it's unfortunately, since the pandemic, we haven't quite got back to that yet. I'm getting close. People are starting to come back, but it used to be jam-packed. And the guidance I told everyone is, if you see me walk into the dining room, I'm looking for a lunch buddy. And if we make eye contact, you're gonna visit with me, unless you're busy. If they're online, I give them. But I have learned so much that way. And it's initially, folks are a little kind of they're not free. But once we start talking about my goofiness with my kids, or things that I do and enjoy doing personally, then they start to really feel comfortable and tell me, this is really how we're living. This is really how things are going for me. And that has been a great source. Or I walk into our housekeeper's break room during break time, just sit down and talk. Because I look forward to that, because they see everything. And the quality in our hospital, the safety in our hospital is so much better, because I get unfiltered feedback from people who are in every nook and cranny of the hospital, maintenance as well. So it's, when you take the time to listen to people, and that's what we're doing system-wide here, you get the answers you need to solve the problems. Our problems are not rocket science. It's really communication.
I'm going to take this opportunity to slightly put you on the spot. One of the things that I always put effort into was making sure I talked with everybody in the hospital and throughout the system. So it was nothing to walk with a group of executive leaders, and the janitor, for instance, would say, "Hi, Dr. Gilkey." That was something I always put a lot of effort in. So putting you on the spot, when you walk around the hospital, does everyone say hello to you?
Oh, absolutely. But I engage them first.
Oh, okay.
By name.
See, that's really amazing.
When I arrived, I make it a point to write birthday cards to everyone. And
wow.
Yeah. So, but when I arrived here,
Wow.
and I usually do it initially, and it helps me learn everybody's name. And I get a list every month, and I could write those cards. That is huge, because I did learn the names very quickly, and it shocks people when you know them by name. And because then again, it's all about trust. And if they feel they are important to me, that's the, I guess if someone said, what's the key to success in leadership? It's legitimately care and
Yeah.
legitimately, right? And so, and when I know their name, I that just starts a conversation where I learn so much more about them. Everybody can do something that I can't do, and I
Mm.
respect that, and I'd like to know more about it.
It is a team activity. Well, Greg, this has been great. I'm going to ask you to stay on video and stay with us and invite Jim Jarvis to join us as well at this time. And Jim, you have a story to share, so if you would.
Yeah, I don't know how I follow Greg. That's those are just amazing stories from a leadership position, and so kudos to you, Greg, for being the dynamic like you are. Yeah, so I just wanted to, kind of tie up what we've all been talking about here. As a family physician, my entire career was spent asking people, "How are you?" And I hope that most of the time that they were not a platitude, that I really was concerned. But I'm sure there were times when I was just busy doing something else. But I just want to share an experience I had way back in 2020 when we were really in the thick of unknown when it came to COVID. So late spring, early summer, we didn't have any treatments for COVID. Vaccines still seem to be so far on the horizon. Hospitalizations were very high. People were dying. Our friends, it was just a bad time. And of course, in my role running our incident command, I was extremely busy. But I did take time for myself, and I would take a mental health break. And one of the things that I like to do is just simply get out of my office and go outside and walk around the hospital. And one time when I was doing that, I was out on State Street here in Bangor, just kind of walking on the sidewalk, and a car pulled up alongside me. I did not recognize the car, and I certainly didn't recognize the individual driving. And they put down their window and they said, "Hey, Dr. Jarvis, how are you?" And in today's day and age, I was definitely taken aback by a stranger just even, pulling over. And you can imagine I probably had a little bit of fear and anxiety as well with some other incidents that are going on in our communities right now. And clearly he recognized that, and he said, "Hey, listen, for the past few months, we see you almost every single day on TV or hear you on the radio, and you ask how we're doing. I just want to know how you're doing." And boy, what a moment. Somebody who I had no previous relationship to, or at least I didn't realize that I had a previous relationship, took an interest in me. Thankfully, I was actually doing well, which was good. And I responded, "Oh, I'm doing good. How are you doing?" And we kind of exchanged a little bit of talk back and forth. And then he went on his way, and I went on my way. But in reflection, here was a person who had someplace to be. He was clearly in his car going somewhere, but he recognized me and wanted to just check in to see how I was doing. Very, very powerful. And each of us has that ability. Greg just nailed it with what he does on a day-to-day basis. People who know me know that as I walk through the hospital, I am the one that says good morning to people. I thank everybody whenever I see them doing something. It doesn't matter what their task is. To me, in healthcare, everyone that works for us is equally important, whether you are the executive of the facility, whether you're a physician, nurse, or you're one of our important housekeeping staff who keep the place clean, because I always tell them they have the most important job. They protect all of us every single day. And so having that personal touch, I think, can make a huge difference for all of us. For you, as you talk and communicate to your employees and your customers and your students and your staff, just taking that brief second to not just ask, "How are you doing?" but to pause and give the attention needed. I love Greg's idea. He takes a note when somebody says, "Well, here's how I really feel." Because oftentimes it's that greeting in the hallway. "How are you doing?" "Oh, I'm doing great." And then you just keep on walking. Because we're not all doing great. And those of us that are having trouble need to have that voice, and we need to be heard. And it's empowering for both the person who asks the question, but impactful for the person who heard the question and then knows that their answer is being heard.
Jim, I'm going to probe a little bit further, trying to understand the impact that this approach can have. So I'm going to ask you to go back to that day, thinking about how you felt at that moment, but more importantly, how did you feel the rest of the day after someone showed that genuine concern for you?
That's a great question, Ed. I will tell you, I smiled larger than I normally do, and of course that's important, especially here in the hospital where we're wearing masks. So a big smile you can see through that mask. The expression is still there, and it's important. So yes, I was happier for the rest of the day, but I think more important is the fact that here I am now, 2.5, almost 3 years since that incident, and I remember it crystal clear. Because it was such an event at a time when I needed to have somebody just show that voice. And I'll hear people talk all the time. When they see me on TV, I always seem relaxed. I always seem like, at least I try to put a positive spin when I can. Somewhat that's my television personality. That's a facade sometimes. And that connection, it still resonates. I share that story quite often because of how impactful it was. And then it changes me. Even though I might have been the person that stopped every day to say good morning to as many people as I could, I go out of my way to do it now because I hope that somebody else, their day is a little bit brighter because I took an interest, even if it was just for the moment. And again, I think you heard that resonate from Suzanne and Tony, and certainly from Greg and his leadership style.
Yeah, thanks, Jim. And thanks for bringing us on that personal journey there. Suzanne and Tony, if you would join us as well, we'll go into our question and answer period. Great. Oh, look at that. My wish is your command, apparently. So Suzanne, this question is for you. So Northern Light Health is a large company with layers of resources to work on a campaign like How Are You? Think about what you learned, what you thought about during the process, and help our audience to understand the essence of this approach and how they can apply it in perhaps their smaller companies.
Sure. So, I think, first of all, you don't need a big budget or deep resources to connect with people. It ties back to the golden rule: treat others as you wish to be treated. So, you heard Greg say it. It's about building trust and setting a culture where people feel free to take care of one another and be open to ask questions and to also be receptive to questions that others might ask of you, because it's not a one-way street. If you're going to ask people, how are you, and wait for an answer, then they're going to say, I'm fine, how are you? Or, I'm not having such a great day, how are you? That sort of thing. So I think it's really all about just creating that culture of people being free to have a conversation.
Well, let me follow that up. In the case of Northern Light Health, we've been promoting a culture of caring for several years. I mean, that's part of our vernacular at this point. Is it as simple as how are you really? Or do managers and owners need to build a foundation, a culture for this type of approach to be successful?
Right. Well, I would say people can always spot when it's not genuine, right? So it really has to be something that you individually can embrace and own and bring to life. Here at Northern Light Health, starting at the very top, our president and CEO, Tim Dentry, is very clear that we are driven by a culture of yes. If we can't do it now, we'll find a way to do it. So how can we help? How can we care for one another? And that can work anywhere. That's not just something that we need to do in healthcare. Just being curious, asking questions, being open and honest and sharing them, and willing to accept feedback. Because sometimes when you ask people, what's going on, how are you? And they don't answer, and you say, how are you really? Sometimes, you're going to get more than you bargained for. So I think being open to talking through things with people, and then, remembering and following up. It really is. I go back to the golden rule. We all learned it in first grade, right? Treat others as you wish to be treated.
Excellent. Thanks so much. Tony, I see that you've answered an open question in our Q&A box, and I believe everyone could see that. So I'm going to switch gears a little bit here and ask you this. So please share your thoughts on what someone could do or recommend if the person answers the how are you in a negative way, such as, I'm not doing so well?
I mean, that's a good question, Ed, because I think as much as we rushing and we don't feel we have time to ask that question, how are you? Sometimes the opposite can happen, is that we're actually afraid what answers we're going to get. And that's why we don't say, how are you? So, and first of all, I have to say, majority of the time, you're not going to have that issue. You're going to have just a simple, really, let's kind of almost similar to what Jim and Greg has related, really just a great exchange. And people say, hey, thank you so much for checking in, whatever it may be. And even when you do get something that, excuse me, someone is giving you something that's maybe a little bit more loaded, if you want to call it that, they may not be even asking for an answer, because I think there's a tendency for us to feel like we have to give an answer, saying, oh, you need to do this, you need to, or no, you don't. And I think oftentimes just being there to listen, because in a way they're venting to you, and that's all they need, because you heard them. Now, granted, you may say, okay, just did you talk to someone else about it, and things like that, just like a little thing in there. And I think that's often a good way to just let them know you acknowledge them, you heard them, and next time you see them, you can say, hey. And that's the other thing to follow up, not just how are you, but next time saying, hey, how are you? Like I remember one time we have a staff member who talked to me about his daughter. So it's been about 5, and it's not even take that much time of your life. It's like a minute or two, and that's all they talked about. Next time when I said, how are you? I also, how's your daughter doing? Boom, you just heard that person. The person know you remember him or her, about his home situation, and that you care. That makes a big difference. And that actually would imprint in their head more so of your connection than the everyday, how are you, when nothing else happens.
Yeah, I could connect with that. I can remember probably about 2 months ago, I commented to my boss how impressed I was that she knew all of these details about our staff, and how it came across that she genuinely cared about them all. So I think your points are well taken. I'm gonna do a quick follow-up, and I know this relates to a question that you did answer. An important component is connection with another person, and sometimes the connection is a shared misery, but other times it's not. So what are some ways the inquirer can connect with the person they are asking, how are you? Like that connection. Talk about that.
That's there's a little bit of individualness to that, because whatever style you're good at, some it could be, if you're more written person, like as Greg says, sometimes you write cards and stuff like that, or if you're kind of more one-to-one exchange, that's maybe more your style. You can loop in humor about it, and how are you, because like for example, I even said to one person who is a Giants fan, I said, oh, how's that doing? It stunk this year. I mean, like, kind of make joke out of it, but that person, remember, that they know Giants. So it's all these little things that you can do. And I think don't get into a situation where you feel like you need to make things up. Like I feel like a forced situation, because people are not stupid. People know you're forcing your interaction with me, and therefore it'll be perfunctory, how are you, and they're not going to tell you anything. They need to know that you're genuine. How are you? How's your weekend? I mean, did you, someone's a hunter. Did you go hunting this weekend? Boom. I mean, all these little things would just make a big difference in terms of connecting. And kind of reiterate with that, what my response to, sometimes you just need to start with the simple things. People you already know, people you like, your families and stuff like that. That gives you a basis to develop more connection, because we often, one of the complaints that I know I hear from a lot of folks is that they connect well at work, but they can't do that at home because they're so disconnected. So I think that's where you also need to prioritize where things are. But definitely, if you can start with something narrow band with your friends and families and coworkers, small group, and then slowly at one a day, you'll be surprised at how many connections you can make, and sometimes without you even thinking about it.
And then you could build on those connections when the chips are down.
Yeah, and I think the important thing about this movement, if you want to call it that, it's not a new movement, but what we want to remind people is the fact that we want to make it second nature to you. You shouldn't feel like you need to do this. You're just no different from you just walking down and just saying, hey, Jim, how are you doing today? I mean, that should be what we want to achieve. So.
Great. Thanks so much, Tony. Greg. You are a successful leader, and that's my observation. Focusing on your genuine concern for others, what do you think are a few of the secrets to your success? Like some of the things you say and do that helps people trust you.
Well, I kind of addressed that up front, and I think the unique thing is that I do insert myself into breaks and lunchtime and want to talk to people when they're relaxed, because I want to talk to them. I'm not running off a script. I'm not, I genuinely want to know how things are going. So I think that's helpful. I think the fact that I do in fact write everything down and I do follow up on it. I love feedback. Sometimes a patient will call and be upset and leave a message on my phone. That's the very first call I return as soon as I get back to my desk. If I get an email from a staff member that says, and I'll give you an example, I had a nurse tell me that the emergency department at EMC was safer than ours because they did X, Y, or Z. I came in that evening, she worked night shifts, and I met with her and said, what are those differences? And she gave me enough so I could call Rand and find out, how can I do that here? I mean, just being so approachable allows us to share information that improves us so quickly. And I think it's about concern. It's about actually caring it, and I think that's the secret.
So here's probably the most important question I could ask you. Are you trustworthy?
I think I am. But it's
well, that might be one of the secrets right there.
Yeah. I'll tell you, through the pandemic, it was difficult because with Truth on Monday was different on Friday. And you've always got to kind of do that audit trail and circle back and say, we're working with the best information available. And I'm not uncomfortable in that environment, because I have, throughout most of my leadership career, I've lived in an environment of constantly changing situations. And
so that adaptability and flexibility.
Yep. But I also realized the importance of doing that little audit trail to make sure everyone understood it was true on Monday when I said it. And now we're on Friday.
Yeah, great. That's excellent. Well, thanks so much for that. I'll comment that Carol sent a very nice piece in the question and answer, pointing out thank yous to healthcare workers, healers in the community, that this is all hard work. She appreciates all of us. So thank you, Carol. Aaron points out that as a former nursing supervisor at Easton, Maine, found that written notes to the home address with positive patient comments from rounding was really welcomed and saved, and 15 years later still has them, showed the caring. So, I think there is a lot of power in that written note stuff. So very good. Let's see, I want to try to fit in one more thing. Jim Jarvis, you had answered in the chat a question that was raised about viruses killing hosts, etc. Would you mind commenting that? I'm concerned that went to the hosts and panelists and not to the open audience.
Yeah, so the question was that a virus that continues to kill its host can't continue to survive, and so does that mean that viruses just tend to always get weaker and weaker? The gist of the question, and while that is actually true, the reality is that, and when we're talking about a virus that affects human beings, there are 8 billion people on this planet, and COVID obviously continues to be a worldwide event. So that means that there's a lot of hosts out there that viruses can infect. And not only that, the host is not just humans. We know that there are animal hosts as well. We know that deer here in Maine are infected with COVID. It just doesn't cause illness in them, but it allows mutations to occur. And so that's the problem, is that new mutations can occur, and while they may be more deadly, there's still a lot of places for them to spread. And a great example of that is just looking at influenza. Influenza has been around since antiquity. Its name really means pandemic, and came from because they recognized there was something that was hurting their population, and yet we still deal with influenza year in and year out, causing severe disease and deaths. And so the likelihood of a respiratory virus that has a long incubation period and has symptoms that last a pretty long time, even in those people who are severely ill and ultimately succumb to the disease, just allows for that to have constant spread. Again, contrasting that to other viruses that kill hosts very quickly, like Ebola, we've seen that those outbreaks quickly die out simply because, unfortunately, the virus has no more place to go.
Well, thanks, Jim. I appreciate you fitting that in. And alas, we're at the top of the hour. I could certainly go on another hour. You've heard me say that before, and here we are again. So we have included resources for you at the end of this presentation. Thank you all for joining us, and thank you to our panelists for sharing such vital information. I hope this hour helps you to successfully manage your workforce. Just a reminder, we will be emailing you a survey right after our conference. Please be sure to give us your feedback so we can continue to provide relevant information. Our next session will be on February 9th with a look at healthcare's financial challenges and what that means to you. I hope you will join us. We will send you the link for this session. We encourage you to share the invitation with your friends and colleagues. By working together to promote good health, we will be promoting good business. Thank you and have a good afternoon.